1 minute. 30 seconds, actually.
What's that, buddy?
You're my right-hand man.
Finally. It took you so long. My friend gave me a caribou leg, Joe.
Yeah.
You know, he's living in the same place I lived in Mushkegowuk.
Oh, okay.
Out the base.
Mm-hmm. Did you enjoy it?
Oh, yeah.
Yeah.
It's like candy.
Okay. We'll all come in very tight.
I'm getting in the middle where all the tall people are.
Yeah, and you're behind the speaker. So I'm safe.
Well, good afternoon. This is a historic day. I'm Charlie Angus, Member of Parliament for Timmins James Bay. We have an extraordinary cross-section of leaders today to work with us on the launching of this campaign. We will have remarks from Natan Obed, the president of ITK, Grand Chief Jonathan Solomon from Mushkegowuk Council, Chief Isadore Day, Chiefs of Ontario, Julie Campbell, the Executive Director of the Canadian Association for Suicide Prevention, Dr. Laurent Marcoux, the President of the Canadian Medical Association, Mike Villeneuve, the CEO of the Canadian Nurses Association, Marilee, Nowgesic, the Executive Director of the Canadian Indigenous Nurses Association, Courtney Taylor, who's been an extraordinary activist on the mental health front. Nous sommes ici ce matin de lancer une campagne nationale, de mettre en place les ressources nécessaires pour répondre aux crises de suicide partout dans notre pays, et aussi de lancer une conversation nationale afin de sensibiliser les populations canadiennes sur les nécessités de soutien, les familles et les personnes pour créer les vies de santé mentale adéquates. Dans ma région, dans la région de Nord-Ontario, les vagues de suicide représentent un désastre social et c'est nécessaire pour le gouvernement de travailler ensemble, les communautés et les leaders, de répondre à cette crise-là. Et je suis très fier d'avoir le soutien de ces organismes nationaux pour ce projet. 9 years ago, I flew into one of the communities that I'm elected to represent, and it was in the middle of a suicide crisis. And it felt like I was going into a war zone, seeing the trauma on the faces of the frontline responders, the police, the nurses, the families, who were doing everything they could to respond to this crisis at a time when the government was laying off the frontline child welfare workers because the government said they had spent their budget for the year. Well, they had spent their budget because they were trying to keep children alive. And in the middle of that dark time, I remember Ron Pate, who was the principal at the local school, who was a veteran of the Gulf War, announced on the local radio that he would keep the school open all night long because he said, I'm not going to lose another child on my watch. And those words stayed with me. And I also thought, what kind of nation sits back when its young people are dying. Quelle sorte de pays regarde les morts de ses enfants et rien faire? And out of that time, since then, we've seen crisis after crisis in so many communities, in Lalash, in Attawapiskat. And we were here just recently over Wapakika when young people died so needlessly from a lack of commitment and vision from their partners at the government level. So what we're saying is we need a national action plan because children and young people and seniors across this country continue to die. And it's not just in Indigenous communities. Every month we are losing the equivalent of a jumbo jet full of people. And they are in working class families. They're in the trans communities. They're in ordinary families across this country who are dealing with this crisis on their own. And we are the only G8 country that does not have a national action plan on suicide. And we can look to examples where plans have worked. We can look to the region of Quebec, which has dropped their numbers by 50%. In Nunavut, where a plan is being put in place, and I want to thank ITK and Jack Hicks and their team for inspiring so much of what can be part of a national plan. So what is a national plan? Well, there's many aspects to this national plan. We need to start working with the leadership in the Indigenous communities, as well as with the various cultural communities across Canada to create the programs that work. We know, the communities know what work. We're not calling for another study here. We're calling for a commitment to work and put the resources on the ground. There needs to be adequate training for anyone who's involved in dealing in the prevention of suicide. What we also need is the data and the statistics so that we can identify the hotspots. One of the things that shocked me most in dealing with this suicide crisis in Indigenous communities was that Health Canada doesn't even track the young people falling through the cracks. Well, just because you don't track them doesn't mean you're not responsible. If we get the data and we get the statistics and Parliament is forced to prepare reports on a year-end basis, we can start to see whether or not the resources that we're putting on the ground are working, and if not, why not, and how to serve better. But fundamentally, this campaign is about a national conversation, and that national conversation is not partisan. It represents every person in this country has a stake in good mental health. And we want to bring the government together as partners, not dictating how it's going to be, but to listen and to learn from the people who've been doing this work and to say, Canada will take this issue seriously. So before we hear from the various organizations, I want to introduce a young man who has been very inspiring to me, one of the youth reps from Treaty 9 Anishinaabe Nation, Randall Crowe, who's been on the front lines of suicide prevention and mental health support for so many young people in the communities of the Northwest. And we are here to say young people like Randall should have the full backing of their nation. They should not be doing this work alone. I'd like to invite Randall to say a few words. Thank you.
Okay, good morning. As Charlie said, my name is Randall Crowe. I'm from Deer Lake First Nation. And I'm only 25 years old, and I've been doing this volunteer work for a number of years already to go and assist communities that's been afflicted by suicide. I've been to a number of our 49 communities, a good chunk of those 49 communities that NAN represents. And the organization that often asks and requests for crisis teams to go is Natan Child and Family Services. They have a crisis department there. And when I hear of a suicide happening within those 33 communities that Natan serves, I usually feel led to go and help and support these communities because of, it's I've lost a cousin at a young age to suicide, and that was the very first time I've ever experienced such a loss in this way. And I believe this is why I go and support the communities that suffer the loss like this. And I believe that we as people, we as individuals, need to do our part to encourage our young people, not only our young people, but anybody that is suffering due to mental illnesses or wanting to cut their life short. We as individuals can encourage them to live their life to the best of their ability. And you know, we often see people withdraw themselves from other individuals, from other groups. And some people need to, we talk about this national suicide plan. I believe that a lot of people in our communities need to, like Charlie said, be trained in these areas. And there's a program it's called assist training, and this training allows you to see signs of someone that wants to commit suicide and how to help them. This training allows you to get tools of how to assist someone that wants to cut their life short. And you know, it's not a good thing when you hear of a young person wanting to take their own life. I've been to a number of calls like that where we would set up a team from Deer Lake to go and support these communities. A number of times we usually send a team to go and assist, and you know, many times the guys that go with me, they don't even sleep. Sometimes they only have an hour rest with the 3 days that we're there, because they're on suicide watch, and they want to assist the communities to not want to see another young person or another person take their own life. And like Charlie said, we've been to communities like Wapakika, Peganjigam, and Big Child Lake. A number of these communities that lost a good chunk of youth because they wanted to end their life. And like I said, we as people can do our part to encourage someone to live their life to the best of their ability. And I believe that the number one cause why a young person wants to take their life is because they're getting bullied. Because they're getting bullied at school and online. I've been to a community where I've seen a girl that committed suicide. I looked through the parents allowed me to look through her journal, and she had a plan of how she was gonna commit suicide. She drew a picture of how she was gonna do it. And why, when someone seen this, why wasn't anything done? Why wasn't anyone in the healthcare field trying to help this individual? And I believe that we as leaders can call on the government to have better mental health services in our communities. You know, I've worked as a mental health worker now for 5 years. And I can say that I'm only 25 years old, but I can say that I don't even truly know how to work as a mental health worker. But I know how to support people. And we need training. We need people to be trained in these areas. So when a crisis like this happens, we can save a life. We can save our young people, not only our young people, but others. We know that a lot of people suffer from hopelessness, but we can present hope to them. We can send a message saying that your life matters. And we as individuals can show them love so they can continue to live this life that they were blessed with. So thank you. Thank you for this opportunity to address you this morning. Thank you.
My name is Natan Obed. I'm the president of Inuit Tapiriit Kanatami, Canada's national Inuit representational organization. We represent 65,000 Inuit across Inuit Nunangat and wherever Inuit may live in this country. I want to thank Charlie Angus for putting this motion forward. I also would like to thank everyone here and all the leadership, First Nations, Métis, and the Canadian leadership that is supporting suicide prevention. Inuit Tapiriit Kanatami released a National Inuit Suicide Prevention Strategy in 2016. And we went about creating that strategy through three basic tenets. It would be globally informed, it would be evidence-based, and it would be Inuit-specific. And we took this path with a very clear understanding of the failures of the past and the fact that our rates of suicide, which are between 10 and 25 times the rates of Canadians nationally, happened from the 1970s until the present. And we have not done things, we've not been able to reverse this trend through the goodwill and the support and the one-off projects and interventions that we had tried to date. There are people across this country who have done amazing work in suicide prevention, and they deserve to be supported in a concrete way. Suicide is a public health issue. The World Health Organization describes it as a largely preventable public health issue. Yet, many of the conversations across this country in relation to suicide and the prevention of suicide do not take that same public health approach. There is still a lot of fear about talking about suicide. There's still a lot of conversations that happen that imagine what causes somebody to consider suicide or to be more at risk of suicide is somehow just ephemeral, that you can't actually understand it. But we know through evidence that that people are at risk of suicide through different life events. And for Inuit, a lot of our social inequities create risk for suicide. And those risks multiply in our communities when even knowing somebody who's died by suicide increases the overarching risk. And then you put on top of that childhood sexual abuse or food insecurity or poverty. All of these risk factors are then combining to create an overarching societal risk for our population. Overarching risk across the Canadian society will take different forms. And any actions that are taken through this motion would obviously have to take into consideration those three principles of evidence-based, globally informed, and then population-specific ideas in order to be effective, where we have not been effective before. But it is time that Canada take this issue seriously on a national level, and we apply the same rigor that we apply to other public health issues, such as communicable diseases or things like H1N1, to the issue of suicide. There are painful personal stories that associate this, and it is really hard standing here before you not to be overwhelmed by the challenges and the stories that I know about Inuit and about the struggles that Inuit communities today face. But we owe it to those individual Inuit, to Inuit communities, and to Canadians as a whole to work on this issue as a priority so that we can ease suffering and create social equity across this country. Nakumik.
English Obed, English Randall, English Charlie. Good morning, Mr. Jonathan Solomon, Indigenous, English Mushkegowuk Council. Wajik. My name is Jonathan Solomon, the Grand Chief of Mushkegowuk Council. Wajik. Greetings. I'm here again in Ottawa to speak on the same issue of suicide that is an epidemic in our communities in this country and in my region. And I want to underscore again, it was over a year ago we were here to bring a national attention when little children as young as 10 were committing suicide at Wapakika First Nation of Northern Ontario. And sadly, that trend today is continuing. Since then, our families and communities continue to bury their loved ones to suicide. In the Anishinaabe Nation, since 2015, there has been 79 reported suicides. Since 1986, there's been 566 suicides in the Anishinaabe Nation. That is only 49 First Nation communities in Northern Ontario. This is staggering. And I'm only speaking what I know in the Anishinaabe Nation, where I'm a part of. There has been numerous calls to action on this very sad and tragic issue. There has been reactionary measures announced, but I'm here today with my colleagues and the professionals to call on a Prime Minister and the Government of Canada to begin discussions on a national strategy on suicide prevention and intervention that will be sustainable. We don't need another study. We don't need another commission. We don't need another inquiry. Everything has been studied. And these studies are just collecting dust in a shelf in offices, government offices, in our offices. These findings are sitting on a shelf while our young people are dying, while our families are suffering, while our communities are enduring a traumatic event in their communities. After the news conference in January of 2017, when I was here with Grand Chief Fiddler and Joshua Frog from Wapakika, Prime Minister Trudeau called us for a private meeting after the news conference. And it was there I challenged the Prime Minister that he can be a champion to lead a national strategy on suicide prevention and intervention. His government has passed 2 national budgets since then, and I am still waiting for a national strategy on this very sad issue around suicides. And I am here again calling on the Prime Minister and his government officials, and ask the Prime Minister, as responsible for the youth of this country, Prime Minister Justin, do what is right. We need to give our families, our communities, a glimmer of hope. You personally visited Pikanchigam. You saw the will to live of the children that you saw there, but you also saw the conditions of the community. If that is not going to trigger a wake-up call, what is it going to take? Twice our youth from non-territory has met the Prime Minister over the last 2-year span. They have presented their issues and called for action. And to this day, they are still waiting. Prime Minister, time for this serious action is now, because it's 2018. Miigwech.
Bonjour. My name is Isadore. I'm the Ontario Regional Chief. I'm also the chair for the Chiefs Committee on Health at the Assembly of First Nations. I just want to acknowledge Charlie Angus and my friends and colleagues that are here to assist in bringing forward this very important issue and proposed approach of a national suicide prevention action plan. I fully support this and stand here in solidarity to ensure that we're all working together to save lives. I just want to acknowledge Grand Chief Solomon for his efforts and the growing frustration of many of our young people that have heard the commitments, that have heard the rhetoric. I'm here standing in support of all of them and in hopes that we can find a way to work together. It's been well known for decades that the suicide rates for Indigenous people are 10 to 12 times higher than the national average. In fact, the Royal Commission on Aboriginal People of 1996 issued a separate report, Choosing Life, in 1995 on addressing the suicide crisis. And we know Natan, Obed just indicated that in his territory, the rates are higher. So we see fluctuating averages, and one life lost is too many. The RCAP report was issued 23 years ago. I cannot begin to imagine how many lives we've lost due to government inaction. And as Grand Chief Solomon just indicated, there are many in the north and in the Ontario region combined. You can safely assume that the numbers are nearly doubled in totality. In 2001, the National Chief Matthew Kuncum and Health Minister Alan Rock appointed a suicide prevention advisory group. Their report was called Acting on What We Know, Preventing Youth Suicide in First Nations. The report observed that home is not a safe haven. The experience of many First Nation youth steeped in social disintegration and conditions associated with marginalization, physical, emotional, and sexual abuse, neglect, poverty, substance abuse, and deplorable socioeconomic standards. And as my friends and colleagues just indicated, many of those conditions just have not changed in 20 years plus. RCAP and numerous reports and studies have all recommended that the eradication of poverty, along with ending social dysfunction that breeds despair, must be our number one priority. We all know how to create happy, healthy communities, and it's about sharing the land and sharing the wealth from these lands, as indicated in our treaties. RCAP specifically recommended that federal, provincial, and territorial governments, through negotiation, provide Aboriginal nations with lands and that are sufficient in size and quality to foster Aboriginal economic self-reliance and cultural and political autonomy. The 2007 IPRWASH report recommended the implementation of resource revenue sharing and the establishment of a treaty commission in Ontario that would facilitate and oversee the settling of land and treaty land claims in Ontario with full cooperation of the federal government. This means governments working together. We already have a shining example of what happens when resource revenue sharing becomes a major factor towards eliminating poverty. The longest running resource revenue sharing agreement in Canada is between the province of Quebec and the James A. Cree, which was signed in 1975 and renegotiated in 2002. Between 1975 and 2005, over 50 years, it is estimated that the Quebec Cree will receive as much as $5 billion in revenues. As a result, the Cree enjoy a high level of prosperity through spin-off companies like CRECO and organizations like Cree Mineral Exploration Board. In contrast, the Ontario side of James Bay continues to be ground zero for poverty, despair, and never-ending suicide crisis. In April 2016, the Chiefs of Ontario provided a Poverty Action Now discussion paper to both the federal and provincial governments. It simply states, poverty is at the root of every tragic First Nation statistic. Poverty is killing First Nation people in Ontario. Our paper calls for a two-pronged strategy that includes immediate targeted funding to address crisis-level needs for communities severely lacking the basic infrastructure and support services, along with a First Nation-led process for long-term and sustainable poverty reduction strategies. Addressing two of Canada's colonial culprits, the Indian Act and the Indian Residential School legacy, helps narrow the focus about where we need to be to address issues around First Nation suicide today. Failure to take such a comprehensive and inclusive approach renders our youth and our First Nations in danger. With the rates of suicide on an alarming increase, especially among children as young as 10, a national suicide strategy is a must. We know this. We need Canada and the provinces to clear a place at the table to discuss this during the transformation of Canada's healthcare system. As chair of the Chiefs Committee on Health, I remain ready and committed to do my part to support all of our First Nations across the country, and we also need to individualize and provide, as part of the collective, a strategy that is culturally relevant to our own territories. And we must also work towards creating prosperity. Just some concluding comments. When we think about this, this really is about saving lives. And as my friend and colleague Charlie Angus indicated, this needs to be a nonpartisan approach. It's an approach that requires a seamless action that sees no weak link in our approach. If there was a child sitting in this chair, all of us would work towards saving that child's life. That's really what's at the heart of this. There are children today, single moms. There are people suffering, major socioeconomic issues. We have the Island Lake meth walkers that are coming to Ottawa today. They are highlighting the critical aspect of what crystal meth is doing in their communities right now. These drugs are taking lives, yet because they're remote communities, they're out of sight, out of mind. We must take a comprehensive approach to action. We must work together to save lives, and I fully support everybody that's here to do that today. Miigwech.
Bonjour. Merci beaucoup, Charlie, pour lancer cette initiative. I'm Julie Campbell from the Canadian Association for Suicide Prevention, friendly called CASP. We're a nonprofit association, and we rely on the volunteer efforts of experts, researchers, clinicians, grassroots associations, and individuals that have been working for over 30 years to prevent suicide in Canada. CASP was present before suicide prevention became present on the public agenda, and we're very happy that it's now moving forward a bit more faster than it was. Suicide can't be explained by a single cause. We know that. Well, prevention can't be done by a single action either. There's been a lot of work done over the years to prevent suicide, but it's often isolated. It's often for a short period of time. Sustainability has to be present too. So we need to break the silos. We need to work together. We need to share our expertise and our experience to make it work. And that's what a strategic plan can do. When we talk about suicide, we often say that we want to reduce the rate. But suicide is much more about person dying by suicide. It's people that think about suicide, people that attempted suicide. And it's about all the mothers, fathers, cousins, and friends that are worried day over day because they're afraid of losing somebody by suicide. We deeply believe in a national action plan. We need to utilize our cumulative experience and expertise. On veut coordonner nos efforts. On veut combiner les meilleures pratiques pour arriver à non seulement prévenir le suicide, mais aussi améliorer la vie des gens, créer de la guérison, créer un sentiment d'empowerment et vivre beaucoup plus heureux. Merci.
Bonjour. Je suis très content d'être ici aujourd'hui en compagnie de ces gens qui veulent faire une différence vis-à-vis ce grave problème du suicide. Et je le fais aussi au nom de mes patients que j'ai suivis pendant 30 ans dans ma clinique. Et je le fais aussi au nom des cris de l'abbé James que j'ai vu confronter à ce problème où j'ai été consultant pendant 5 ans pour les questions médicales. Et on behalf of the more than 85,000 members of the Canadian Medical Association, I'm proud also to be here to stand and speak in support of Mr. Angus for the National Suicide Prevention Action Plan. At the Canadian Medical Association, we envision a country where all Canadians can enjoy good health, and that includes mental health. In that vision, all Canadians will feel safe acknowledging their mental health problem and seeking help. All Canadians will have access to a full range of treatment that are effective, evidence-based, and culturally appropriate. And all Canadians will feel supported by their communities as they work to maintain their mental health or recover from mental illness. We have come on a long way over the years in increasing public awareness and reducing stigma and discrimination around mental health. But more must be done, and strong leadership is required. As for that, I recognize your work today. That's why I'm so proud to be part of the campaign launch here today, and to see fellow health care providers, governments, communities, patients, and their families coming together in support of Mr. Angus' plan. It's time for mental health to become a real priority in our country, and for Canadians with mental illness to have access to the care, support, and respect they deserve. Il est grand temps que le Canada fasse de la santé mentale une priorité. Que tous les Canadiens affligés par des problèmes de santé mentale aient accès aux soins dont ils ont besoin, avec tout le respect et le support qu'ils méritent, et c'est ce que nous devons à chaque Canadien, chaque membre de notre famille et chaque personne qui nous entoure, qui sont confrontés avec ce grave problème de santé mentale qui conduit parfois à des conditions beaucoup plus tragiques qui sont le suicide. Je vous remercie et merci beaucoup. Thank you.
Good morning, everyone. My name is Mike Villeneuve, and I'm very proud to be the CEO of the Canadian Nurses Association. Je suis directeur général de l'Association des infirmières et infirmiers du Canada. First, I'd like to begin by acknowledging that the land on which we gather today is traditional unceded Algonquin territory, as is the place where the Canadian Nurses Association sits. I'm honored to join you, Mr. Angus, a Member of Parliament for Timmins James Bay, and the very esteemed individuals with us here today. And your steadfast leadership on this issue, Charlie, has been unparalleled. So on behalf of the 139,000 registered nurses and nurse practitioners of the Canadian Nurses Association, we thank you and join you in calling for a national suicide action plan. Pardon me. We urge all MPs, all parties to vote in favor of your motion. The time is long overdue to take definitive action on mental illness and mental health challenges, particularly reducing stigma associated with being a consumer of mental health, bereavement, and other associated services, which is one of the provisions of the motion. CNA recognizes that the Mental Health Commission of Canada is spearheading efforts to reduce the number of people in Canada who die from suicide, and we expect to see the Commission play a key role in this ongoing effort. In collaboration with the Commission, CNA has recently co-developed, an accredited suicide prevention learning modules for nurses, and we're committed to doing more of that work. We endorsed the Collaborative Mental Health Charter more than a decade ago at CNA, 2006. It's time for action. We're a wealthy country, full of smart people. We know lots of the solutions. We've got great human resources, and we owe it to ourselves to act now. I'm pleased to provide my colleague Marilee Nowgesic the stage. Thank you.
Good morning, everyone. I'm Marilee Nowgesic, Executive Director, Canadian Indigenous Nurses Association, and I'd like to recognize the leadership that stands behind me here today, and to my colleagues whom are also here in support of Mr. Angus's national plan to address suicide. On behalf of the Indigenous nurses across the country, we look forward to working in the development of this national plan in order to support our Indigenous communities and all the communities across the country to addressing suicide at the Indigenous community level. I'm also looking forward to addressing the needs of our healthcare professionals whom are looking at postvention while we look at how we can address their strength and revitalize their energy so that they can help the people at the community level when they are dealing with this crisis. On behalf of the organization, I support the National Action Plan and we look forward to working with Mr. Angus. Thank you very much.
Well, thank you so much. And for journalists upstairs watching, if you want contact for any of the experts that stand behind me, we can help make arrangements. Merci bien.
Thank you.
Thank you so much.
Merci beaucoup.